I'm going to give you a brief overview of the situation of suicide in Pakistan as much as we know about it. It's a very vast subject, and in 15 minutes, I can only cover aspects of that. So you must have seen the picture of and read about Roshan Farrukh, the young student at Beacon House National University who died a couple of weeks ago by throwing herself off the fourth floor of a college building. And before she did that, she had been posting a number of messages on the social media. And the big question is, could her death been prevented? And the answer is absolutely. Most suicides are preventable, though not all, but certainly for someone who is in an institution, and that also a good institution, if the mechanisms were there to address some of the issues that led her to die by suicide, certainly should have been there. So yes, it was largely preventable. I think all deaths of young people in institutions are preventable, though when you look at the society, it becomes more difficult to prevent suicides. Suicide is an extremely complex phenomenon. It is not that easy. There is no cause and effect, and there are several factors, biological, psychological, personal, social, that all come together at a certain point in time to make a person suicidal or think of suicide. And depending on what he or she uses as a means of that attempt, may end up either as a unsuccessful attempt or a fatal outcome. Globally, it has become a major health problem, public health problem, because of the number of people who die by suicide every year, which is anything between 0.8 to 1 million people. In terms of rates, as we describe any kind of morbidity or disability, it's 11 per 100,000 people. And this is important to note because as we go along, then you can compare the rates in different parts of Pakistan with this global rate, which really means that by the time we finish this program, maybe in a couple of hours or so, about 300 people would have died by suicide somewhere in the world. So it's a sobering thought. Of the global suicides, majority of them are taking place in low and middle income countries like India and Pakistan and China and so on. In fact, India and China, the only two countries, these are obviously countries with very huge populations, contribute 40% of the global suicides. Traditionally, suicide rates in Islamic countries had been low and still low compared to the non-Islamic countries, but they have been rising. And in countries like Bangladesh, Turkey, Indonesia, as well as Pakistan, whatever information we have tends to show that the rates in these countries are rising. Again, looking at the global picture, more women attempt it, but more men die by suicide. That's a overall phenomenon, with some exceptions. In China, it's reversed, more women than men, as well as in Bangladesh. In India, the ratio between men and women suicides is more narrow. It's almost 1 to 1. There are two peaks of suicides. One is in the younger people, and then one in the elderly. But this is global, and there are differences between this and what is happening in Pakistan. As far as marital status is concerned, divorced, single, and widowed people are more at risk than married people. Marriage is seen as a protective against psychological morbidity and suicide. And in terms of employment, people who are unemployed, who have lost their jobs, or underemployed are more at risk of suicide, which is again reflected in the social class, which is the lower social class. But in the West, the higher social class has almost the same numbers as the lower social classes. It's not just the socioeconomic situation that drives people to suicide. There are other factors as well. In terms of the psychiatric causes of suicide, the majority of suicides have very close association with psychiatric illness, up to 90%. And of these, 80%, as much as 80% are suffering from clinical depression. It's not distress, it is not depressive states, but clinical depression. Now, but if you look at it from a different angle, of all the people who suffer from depression, only 15% kill themselves by suicide. Okay, but the number of suicides, if you look at them, then 80% have clinical depression at the time of suicide. Other conditions that are also important include bipolar disorders, schizophrenia, alcohol, drug abuse, and personality disorders. For every suicide that takes place, there are 10 to 20 people who attempt suicide at any given point or in any setting, and about 100 people think of committing suicide, or thoughts of suicide cross their minds. So this is kind of the rough gradient between suicide and a suicidal ideation. And this is again from WHO, that for every suicide, at least 6 people are directly affected. However, in societies such as ours, which is a very collectivistic society, a lot more people are affected by suicide. And as we heard the story of Zareen Sahiba, postvention is what is considered as the psychological morbidity in the survivors of suicide, and they have to be offered help as much as the person who may be on the suicidal process. Now, suicide almost never ever happens in a vacuum. We read in the newspapers that this person broke off the engagement, or was jilted, or failed the exam, and therefore took the pills or drank some poison, but it never happens like that. There is always a story behind that, and it's a pathway people get onto and they progress over a period of time. At the same time, there are thresholds of protection, and people cross these thresholds of protection, and the list can be changed according to one's way of looking at things. So for example, religion for some people may not matter so much as children and family do, or for other people, job may be much more important. For example, in Japan, people have much more connectiveness with the job, and loss of job is considered as a major risk factor for suicide in Japan. This is the map of suicide, which tells you countries which have high rates, which is in red, like Russia and China, countries which have middle rates, like Australia, United States, and Canada, and then countries in blue, which have low rates. But you can see a lot of countries are white, and you can see Pakistan is one of the countries. These are countries that do not collect data on suicide and do not report to the WHO. So these include most of the Islamic countries of the world. Only 3 or 4 countries of the 57 Islamic countries report their data to the WHO. And the absence of data, good data, is a major impediment in coming up with policies and programs that are relevant to the local population. So what is happening in Pakistan? Well, suicide has been happening in Pakistan as in everywhere else. It is reported quite frequently and regularly in the newspapers. We do not know what is the picture in Pakistan except from various sources. It's an understudied and an under-researched topic in Pakistan. We do not know what are the true mortality statistics, and the reasons are many, but I've classified them into 3 main areas: religious, legal, and socio-cultural, and they kind of influence both the official attitude towards suicide, but also many of the people who want to research this. It influences all of us. And I'm really sorry to say, and it's not really talking about myself, except for myself, no one has actually studied suicide in Pakistan. And it's an indictment of the lack of interest and apathy in our professionals in something like this. So Islam strongly condemns suicide and goes really further than any other monotheistic religion in condemning it as an unforgivable sin or a cardinal sin. There is a strong law in Pakistan based on this tenet of Islam that says that if you attempt and you survive, then you can be punished with a jail term of 1 year or a fine of rupees 10,000. There have been moves to decriminalize suicide in Pakistan, but unfortunately it has been put on hold. And there is a huge social stigma, not only for mental health but also for suicide, and therefore people do not come out and seek help. They conceal the fact, and the underlying issue which may have precipitated the the event in the first place, particularly for the attempters who survive, never gets addressed. And therefore the chances of them repeating the act increases. According to law, all cases of suicide, whether they have died or whether they have survived, must be taken to one of the medical legal centers in the country. But people don't do that, and people who have the means will go to the private hospitals where they are given medical treatment, and the hospital conceals and colludes with the family and mislabels them as accidents or some medical illness, and they do not register the case. This really leads to under-reporting and under-counting of these incidents, and therefore we do not have good data in Pakistan. The best estimate that we can come up with based on the WHO's estimate, and WHO uses a very complex way of calculating rates, is that more than 13,000 suicides happen in Pakistan every year, or at least that is what happened in 2012. We do not have, again, good data to compare it with previous years. And if you look at the ratio of one suicide to 10 to 20 attempts and 100 people having thoughts of suicide, these are the figures of what is the quantum of the problem in our country. I've been able to put together different studies to come up with some rates to work on. And you can see in the first column the dates are very different because they're really individual studies by people who have just done a case series. But what we have is the highest rates in Haripur and KP, and you wouldn't really think of Haripur as one that is high rates, but nevertheless, this is what we have. I do not know how accurate the data is, but I've just been able to scrounge around and get some data and come up with certain rates. And the other place is Rawalpindi, the city that we're sitting in. Rates of men in Rawalpindi is probably the highest in the country. However, the highest rates of suicide of any group, any age, is in Gizar and Gilgit in Pakistan. And this has been in the media quite a lot, of suicide in the northern areas. If you remember the global rates of 11.42 and you compare that of suicide in women in Gizar district only, in Gilgit, the group rates are 16.72 per 100,000. But if you stratify that for age, over the 15 years, then it really jumps up to 32 per 100,000. So young women in the hilly areas of Chitral, Gilgit, Hunza, and so on, somehow have a very high suicide rate, and we really need to look into that. Again, looking at the overall picture, two things really stand out. Single men and married women in Pakistan are more at risk of suicide than the other groups. And majority of the suicides in Pakistan are by people under the age of 30 years, so young population. The most common methods that are used in Pakistan, the three most common methods are hanging, use of poisons and firearms. 2/3 of all hangings happen in the homes using the ceiling fan, and the hook of the ceiling fan. Of the poisons, 75% use insecticides, which have organophosphates. These are extremely dangerous substance when ingested, as the son of Zareen Sahiba did, using insecticide. And there's a huge number of firearms in the country, unlicensed, and they're featuring more and more in suicides in Pakistan as a method of killing oneself. Interestingly, this is again something that is different from the West. Medicines do not feature so strongly in Pakistan, despite the fact that these medicines are available over the counter. Common causes that have been looked into, and I've studied them myself, psychiatric illnesses, particularly depression, really stands out as one of the most important risk factors. Other factors like the socioeconomic factors, of which poverty is one, unemployment, low education, disrupted social networks, life events in the weeks or the days preceding the event, and obviously in women, domestic violence. Dr. Asma showed you the slide of common mental disorders. These are some of the studies that have been done in Pakistan. These are prevalent studies, and they all show very high rates of common mental disorders, which is depression and anxiety in the population in Pakistan. And this is the adult population. And if you take the average of these, it's about 30%. So of the 100 million adults in Pakistan, roughly, again, almost 30 million adults are in need of mental health help. Poverty in Pakistan is, we know that a vast majority of our people live under and below the poverty line. However, a lot of politicians make the statement that poverty is leading to suicide. Well, only a very small minority of people who are poor kill themselves. The majority do not. And therefore, we have to look at it from another perspective, that those who do kill themselves, who are poor, probably have developed mental health problems, which then serves as an intermediate between poverty and suicide. And therefore, in order to address suicide in the poor, you not only have to alleviate poverty, but you also have to provide mental health services in the country. So what we know about suicide in Pakistan, that happens regularly across all provinces, cities, ethnic groups, religious groups, across all sects. Incidents may be increased, but we don't have good data from the past to compare the data now. But certainly from the reports, it does appear that the situation is increasing. Non-reporting is very high. We know what is happening in the urban centers of Pakistan. We do have no idea what is happening in the rural areas, where death certificates are not issued, the manner of death is not determined, and people just bury them. So we do not know what is happening in the rural areas. We know that the young are more at risk than the elderly. This is again something which is different from the West. In gender, males commit suicide in Pakistan more than the females. However, when we stratify that for marital status and gender, then it's more young married females and single males. And it's again something which is starkly different from what is happening in the West. The three common methods are hanging, poisons, and firearms. The reasons: mental illness, depression is very high. Again, something that is quite stark, but also reflects the state of the mental services in Pakistan, that very few of our suicide victims are in contact with mental health services. So we are dealing with a large population that may have undiagnosed psychiatric illness. Another very important finding from our studies is that, unlike the West, where people who die by suicide have made several previous attempts, in Pakistan it is the first-time attempters. So majority of people attempt and die in the first attempt. It may be a reflection of the nature of the suicidal process, but also the method that they use. Alcohol features very rarely in suicides in Pakistan, because as we know, it's socially and religiously prohibited. And underlying factors that keep coming through, although it's not been really studied very well in suicides in Pakistan, is social adversity. What are the barriers for suicide prevention in Pakistan? Mental health services are lacking. They're not affordable, they're not accessible for people. Very few mental health professionals, like Dr. Asma has shown, they're concentrated in the large urban centers of the country. We know 65% of the population lives in the rural areas, and the training is not of high standard and uniform across the country. There is a lot of stigma which is influenced by the legal position of suicide, religious religion, as well as the social stigma that mental health and suicide carry. We don't have good research. Like I said, people are just not interested in this area, and people have not been researching it. Data collection suffers. We do not collect data on suicides in the country, despite the fact that we collect data on many other illnesses and morbidity and mortality in Pakistan. And we do not have a national suicide prevention program. We don't have a mental health program, so suicide comes much lower down on the ladder. And there's an apathy, both from the researchers, mental health professionals, and obviously at the government level, there's very little political will. But we hope that this will all change in the near Pakistan. So thank you very much.